Welcome to Sam Outside. I'm Sam and I'm outside. I'm outside for my health. That's right. In doing the reading and participating in some of the actual science and literature behind the benefits of going outside, benefits of nature more specifically, right? Um, it is fast becoming the fourth pillar of health. So the other three pillars, the ones that have been pretty standard: sleep, diet, exercise. And now it's fast becoming mandate and being supported by um, officials, by government. So there's a strong movement lately, and only because it's that time of year, the season, people are more able. I guess there's a significant portion of the population which is taking advantage of this summer season, otherwise known as the tourist season, to find themselves time to go outside. Right? They're going camping. They're going on day trips or exploring, and the things that we're seeing, along with the movement by medical professionals to actually prescribe nature prescriptions, is that initiative is being supported by local municipalities, right? So districts, as well as in our area, it's provincial governments. It might be states near you, right? So the example for this is if you actually have a nature prescription, it's, for example, allowing you 10 free parking passes at a local conservation area. That's the incentive, right? So why would they do that? Well, there's a cost to operating a conservation area, right? They often have some costs, right? There are some amenities to having a place that's open to the public, right? So they've had to clear some land and put in a parking lot that's often gated, or at least the ability to open and close it seasonally. There's often some public restrooms, washrooms, right? The trails are maintained, right, to the best of their abilities, and they're often marked. So there might be some effort for some information and some plaques and some other resources to help people explore, right? To get outside and stay safe. Really, that's what it's all about. So, what are the barriers to health, right? So when it comes to your sleep, well, that might be time. It might also be money, only because the best sleep, they're recommending 8 hours, right? But to fall asleep quickly, deeply, involves a cooler bedroom, a cooler night environment, right? So depending on the time of year, depending on your shelter, that might take some resources, right? Air conditioning, ventilation, things like that. So yeah, but it's time. People just can't find the time, right? Or they're not making the best choices about spending their time, right? It could be your situation. You're on shift work or you're on call, so you're not mentally able to tune right out or to get your circadian rhythm into that habit. The next pillar, if you will, is diet, right? Having what they call a balanced diet. Well, what are the barriers there? Again, could be time, right? So they're recommending stay away from processed foods. Well, there's a reason people are drawn toward processed food, and that is the time. All right, the time. It just take it out of the freezer, good to go. It's already pre-cooked, right? So it's just, you need an oven that can do that. You can microwave it, or you just boil some water. It fills your belly, but might not be giving you, well, it's definitely not giving you everything you need. So the act of having a balanced diet where you're getting, protein, there's a cost to healthy meats, vegetables, fruits. Again, there's a cost to the production and the harvest of that. And hey, if you want to go local, might be another barrier. Seasonal could be one of them, right? And avoiding sugars. Well, that's a big part of the draw to processed foods. It's everything that comes with that, right? So it's delicious. So that's it's pumped full of sugars and other additives. So those are the barriers to a healthy diet. And the next one is exercise. And again, first barrier there is time, right? After that, it might be financial, right? So if I don't have the space or the equipment needed for simple routine, right after that, it's it's information, it's knowledge, experience, right? So, what are the things I can do in my own home if I've got the time? What are the best calisthenic exercises I can do? And after that, it's comfort, man. It's not as comfortable to give up the thing I want to do to get the sleep I need. It's not comfortable to eat certain foods because they don't have the same flavor, right? They don't have the sugars, and that's where I find my comfort, right? And yeah, exercise requires effort, and there's often pain associated with that. There's discomfort, right? And so until you actually put in the time and see the gains and getting that confidence and that healthy ability, capacity, the endurance that comes with the consistency of exercise, well, then again, that's just another barrier. So the barrier to nature is time, and it's also money, right? For most people, they don't have access the way that I do, where I can just step outside my door. So it involves a little bit of transportation cost. And then again, it's information. People just don't understand and appreciate the need for going outside. So that becomes a barrier. So there are all these things that we could do, that we should do, with regard to getting the sleep we need, to eating the foods we should, and more importantly, not eating the foods we shouldn't, and in the exercise, right? Simple act of walking. We walk every day, but if we vary it just slightly and we put some intentionality behind it, we'll greatly add to the benefits of getting your 10,000 steps. And then again, there's nature. Well, let's quantify it, right? So yeah, nature connections, nature therapy, the act of forest bathing, being mindful, nature immersion. That takes practice, right? And it takes time. And to find that what is recommended for the minimum of 20 minutes 3 times a week, or a 5-hour experience once a month, or a 3-day experience once a year, I mean, that's time. That's what those markers are. It's time. And then after that, it becomes the resources and experience and the skill, the comfort that goes along with that. So there's a lot of information out there about those 3 pillars. We've been raised on them, but the 4th pillar is becoming quickly acknowledged, and that information, that need, is being supported by local authorities, by different agencies, by different associations. So in my area anyway, I see it, I hear it on the radio, I see it in literature. It's being promoted. Hey, get outside, get a nature prescription, automatically getting yourself 10 free parking passes. But it's also zoos, it's also museums, it's butterfly gardens, right? So winter, so for us, that is definitely a barrier. So I mean, you can still have a nature experience, an outdoor experience indoors. So find an arboretum, find some butterfly gardens, right? Go to your zoo, go to your nature museum, and that's how you can fill that. But there's a cost associated with that, with admission and with parking. So that's what nature prescriptions are moving toward, removing some of those barriers. Now, it's physicians that can administer, and it's so easy, right? Just, hey, I've got some stress in my life, right? You can read my blood pressure, you can take some blood tests, and right, you can see that we all suffer from some amount of stress. But any empathetic doctor who's acknowledging your need for a change, promotion of healthy lifestyle, they're going to be like, great, well, let's talk about your diet, let's talk about your exercise, let's talk about your sleep, let's talk about how much time you spend in nature. So nature prescription could be written by a nurse, in Canada anyway, Ontario. It can be written by a doctor, physician, and also a physiotherapist. So those are the 3 medical professionals in my area that can help prescribe nature, the 4th pillar for health. All right, so 8 hours of sleep, a balanced diet, whole foods, simple foods, short list of ingredients that you can pronounce, right? They're not so multisyllabic, right? Exercise, just going for a walk, right? Very little in the way of barriers for that. In nature, right? It's trees. So you can have a nature environment without trees, but you can compound the benefits when you find yourself a forest. So ask the next time you're in a medical facility, right? Ask your nurse, ask your doctor, ask your physiotherapist about a nature prescription, right? And then, hey, take a look at your local conservation areas, your local parks, right? What discounts, what barriers are being removed by getting a nature prescription, all right? So put in the time, put in the research, go outside. I appreciate your time for watching and your support. Talk to you again soon. Thanks. Bye-bye.